dermatologist and cosmetologist practicing in Thane, Maharashtra. So there are various factors which cause hair loss. There can be diet, lifestyle, such a stressful lifestyle we all are having. But do you know there is a medical condition called as alopecia areata? It is a different condition altogether, and today we will be talking about the same condition. So why does this alopecia areata occur? Basically, alopecia areata, in this condition, your body's immunity, that is your protection system, it goes against your own hair follicles. That's why it is also called as autoimmune condition. So in alopecia areata, your body's own immune cells, they attack the hair follicles, and in that area there is inflammation, and this inflammation causes the hair loss. So it happens in a patchy format. That's why there is complete baldness in that particular area. There are some common associations with alopecia areata. That can be diabetes, thyroid disorders, and rheumatoid arthritis. So what are the symptoms of this condition? So to begin with, number one, there are circumscribed areas of baldness where there is total hair loss. Number two, you will see sudden hair fall. You'll see your pillow is full of hair. Number three, your hair may turn grey overnight. It is called as graying overnight, but it is not literally overnight. It causes graying of the hair suddenly. And to mention, there are other areas of the body where the hair can fall. Not only from the scalp, it can fall from your eyebrows, your eyelashes, mustache, beard, and even the body hairs. So when there is involvement of all these areas, it is also called as alopecia universalis. And there are other body changes like nail changes. Your nail can become rough, they can be red in color, and there can be small pits on your nails. So alopecia areata, being an autoimmune condition, it doesn't really stop on its own. So how do we come to know that the patient will really need the treatment? So when there are multiple bald patches and they are connecting with each other and forming large area of baldness, then we need to seriously consider the treatment. So the extent of hair fall differs from patient to patient. Every person doesn't have the same kind of patches. Some will have only 1 or 2 patches, and some will have complete baldness of the hair. So can alopecia areata be treated? So the answer at this moment is it can be treated, but it cannot be cured because it is an autoimmune condition. So what are the treatment options? So we have something called as topical therapy and we have systemic therapy. In topical therapy, we have something which promote the hair growth like minoxidil. It has to be applied twice in a day and results may take around 1 month to appear. Then we have topical anthraline. It causes topical irritation of the area, and it causes by causing irritation, it ultimately causes hair growth, which should be done under observation. It should be only done by prescribed medicine. Then we have something called as DPCP to be applied topically. Again, the same mechanism of action. It also causes local irritation. Then we have topical steroids. That also helps in reducing the inflammation and causing the hair growth. And there are other options like injections. So when there are 1 or 2 patches, and in that area, if you want to really have a fast regrowth of the hair, you can inject the intralesional steroids at a 3 weekly interval, and maybe 3 or 4 injections here and there, and you will grow back your hair. So that is a very good option. But when the alopecia is becoming very severe, there are multiple patches, it is involving different areas of the body, at that time you need to consider the systemic options. So what are the systemic options? Basically, because it is an autoimmune condition, we need to give something immunosuppressive. So the category of immunosuppressive we have is steroids as well as other immunosuppressants like cyclosporin and minoxidil. These are to be preserved for the cases which are resistant to the topicals and which are very progressing at a very rapid pace. So they are not to be given as a first line of therapy. So there are few natural therapies which can be tried, but we have seen very catastrophic results because of those therapies. Like patient comes to us applying something called as Jamal Gota. Then we have seen this is a non-scarring type of alopecia. That means there is no permanent scar formation when the alopecia is cured. That means the hair come back. That time there is no residual damage. But if you apply such kind of therapies, which is you're doing some jadi booty wala, or someone is giving you this kind of therapies, then please avoid. You have to take treatment from a proper qualified person. Then other is garlic, onion juice. All these are going to give you temporary result but may cause permanent damage. So please avoid such kind of therapies. You should always go to a qualified dermatologist for getting the options which is suitable for your stage of alopecia areata, and the patient doctor is the best person to give you the right guidance. So alopecia areata being an autoimmune condition, we know there is no cure. But when it is detected early and when the diagnosis is made initially, you can really prevent the progression of the disease to the full-blown disease, and treatment can be started at a very early stage. So when you should visit a dermatologist? When you start seeing a lot of hair fall, sudden hair fall, your pillow is covered with hair, then you have brittleness of your nails. At that time you should visit a dermatologist and confirm if it is alopecia areata. And to mind you, not all kind of hair fall, that is sudden hair fall, is alopecia areata. There are multiple other reasons for alopecias or hair loss. So I have made videos on the same about the other types of hair fall, so you can go back and watch those videos also. And I hope I have given you enough information in this video, and thank you for watching. Stay tuned for the next video. Thank you so much.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.